You finally made it home after knee replacement. Then the reality hits. You have to use the bathroom. Suddenly you're asking yourself, how am I supposed to sit down? How am I supposed to stand back up? What if I fall? What if my knee won't bend enough? I'm Dr. Tyler Goldberg, an orthopedic surgeon in Austin, Texas. And over the last 25 years, I've replaced more than 12,000 hips and knees. And one of the biggest surprises for patients isn't necessarily the surgery itself, it's navigating everyday life afterward. In this video, I'm going to show you exactly how I want my own patients to prepare their home, safely use the bathroom after surgery, move around confidently during those first 2 weeks, and avoid some of the most common mistakes that can make slower recovery. Nobody ever asked this question before surgery, but almost everyone asks it afterward. Because once you're home, something you've done thousands of times suddenly feels unfamiliar. It's not because your new knee can't handle it, it's because you're dealing with swelling, stiffness, temporary weakness, and reduced confidence. The good news? Almost every patient improves dramatically over the first couple of weeks. The goal isn't to be perfect on day one. The goal is simply to be safe. One of the biggest mistakes patients make is waiting until after surgery to think about their recovery. The best recoveries start before surgery ever happens. Walk through your home as if you're already using a walker. Can you fit through every doorway? Are there throw rugs that could become tripping hazards? Are there electrical cords draped across walkways? Can you reach the bathroom easily? Can you get into bed without climbing over furniture? Recovery becomes much easier when your environment is working with you instead of against you. Before surgery, I recommend having your recovery area completely set up. That usually includes a comfortable chair that's easy to stand up from. It includes ice packs or your cooling device. It includes water and medications and a phone charger. And don't forget that all-important TV remote. You'll want a walker close by, and you'll want your compression garments if they're recommended by your doctor. A small table within arm's reach is always necessary. The less unnecessary walking you have to do for those first few days, the better for you. This is where preparation makes an enormous difference. If your toilet sits low to the ground, standing back up requires much more knee bending. For many patients, a raised toilet seat can make those first couple of weeks dramatically easier. If you already have grab bars, then use them. If you don't, temporary support rails around the toilet may be worth discussing before surgery. The goal isn't luxury, it's reducing unnecessary strain while your knee is healing. When you're ready to sit, don't rush. Back up until you feel the toilet behind your legs. Keep your walker in front of you. Reach back with one hand at a time for the armrest or the grab bars if you have them. Lower yourself slowly and under control, and don't plop onto the toilet seat, right? Don't try to squat quickly. Your arms are there to help, and so use them for those first several days. Standing follows essentially the same principle. You scoot forward slightly, you bring your feet underneath you as comfortably as possible, you lean your body forward and you push up with your arms. You stand under control, and once you're standing securely, place both hands on your walker before you take your first step. There's no prize for moving quickly. Slow is smooth, and smooth is safe. Well, what if your knee won't bend? This is one of the biggest concerns patients have. Remember, during the first several days, swelling, not the implant, is usually what limits bending. Your knee doesn't need to bend perfectly to use the bathroom safely. That's why assisted devices can make such a difference early on. As swelling improves, bending improves. Don't force your knee simply because you're frustrated. So, do you need somebody at home with you? Many patients ask whether they should have help. If possible, the answer is an absolute yes, especially during those first several days. A spouse, a family member, or a close friend can really help with meals, medications, ice, transportations, pets if you have them, and simply just giving you confidence while you're getting your bearings early in your recovery. You probably don't need their help for long or even forever, but having another person nearby during those first few days often makes recovery less stressful. Here's some common mistakes that you might have. Trying to do everything independently on day one. How about ignoring your walker or rushing to answer the phone? Are you twisting while you're standing? Are you leaving clutter on the floor? Or are you waiting until you're exhausted before you ask for help? Recovery is temporary. There is no shame in making life easier for a couple of weeks. When does this get easier? For most patients, every few days feels a little better than the last. The bathroom becomes less intimidating, standing becomes smoother, walking becomes more natural, and confidence replaces fear. Recovery isn't one giant leap. It's hundreds of small improvements that gradually add up. If you're preparing for knee replacement and wondering whether surgery is even right for the next step, I've created a simple 2-minute joint pain quiz that can help you better understand your symptoms and whether or not you're even a candidate. You'll find the link in the description below. All right, how about some frequently asked questions? Can I use a regular toilet after knee replacement? Usually, yes. A raised toilet seat can make the first few weeks a little easier, especially if your toilet is lower or you're having difficulty bending your knee. How about when can I stop using a raised toilet seat? That really just depends on your comfort, your strength, your swelling, and your surgeon's recommendations. Most patients naturally transition away from it as mobility improves. Give it 5 days to 2 weeks. Should someone help me every time? Not necessarily. Many patients become independent very quickly, but having somebody nearby during the first few days provides both practical assistance and peace of mind. How about what if I'm afraid of falling? Move slowly, use your walker, and don't hesitate to use recommended assistive devices. Falls are much easier to prevent than to recover from. One of the biggest misconceptions about knee replacement is that recovery is all about the exercises. It's not. Recovery is about making everyday life manageable. Again, walking through your home, getting out of bed, using the bathroom confidently, preparing a meal and sleeping through the night. Those are the victories that you need the first couple of weeks. The better you prepare your home before surgery, the less energy you'll spend worrying afterward. And that allows you to focus on what really matters, and that's healing. I hope you learned something, and I'll see you in the next video.